HIM17, talking to the COO of the Inova Translational Medicine Institute, John Deeken. John, thanks for speaking with us today. You know, you had a great way of summing up the mission of the Institute, so talk a little bit about that.
The Inova Translational Medicine Institute is set up to do research as well as clinical applications in genomic medicine. Okay. How to use what we know about the human genome to improve patient care. And we're in that sort of translational space, bedside to bench and bench back to bedside, in terms of improving patient care.
So it may seem like an obvious question, but for those who might not be as familiar with that particular niche of genomics, how does that inform, patient care? How can that really steer a physician's path in taking care of someone?
I think the best example that we know of right now is cancer risk. We know patients can have genetic variants that predispose them to cancer, and that field's well developed. But as we're discovering genomic underpinnings to a wide range of diseases, pediatric illnesses, adult illnesses, and our area of pharmacogenomics, so using genomic variants that correlate with how a patient will respond to medication therapies. That's what we're trying to translate into clinical practice, testing patients' genomes, making discoveries on their relevance, and then applying it so we can improve patients' care.
And that's hugely impactful because some medicines have, a lot of medicines actually have adverse effects, but those can vary depending on who the person is and how they receive it. So that can really steer care and potentially improve a patient's path through an illness,
exactly.
Suffering a little bit less with those side effects.
You bet. Let me give you a couple examples. It was known that for kids that are going through tonsillectomies, that if they were given codeine as a pain medicine, some kids metabolize codeine too quickly and get high levels of morphine in their body and can actually die from overdose of morphine because of their genetic variants. The FDA changed the label on that a few years ago and are warning physicians about how to doing that. So we set up a test so that every kid, when they're born, gets tested for a number of variants, including that pivotal variant, so that if they ever do need pain medicines later in their childhood, their physicians will know not to give them codeine.
And that's where the tool Medimap comes in, because it has a lot to do with how a patient receives medicine. Right. So talk about that tool.
So we so believe in Inova that genomic medicine is the future of health, that we actually are testing every newborn that's born in our hospital, 10,000 babies born a year. We're offering to their parents free, as part of their care, pharmacogenomic testing and a series of genes that impact a large number of medications that child might be exposed to in childhood and adulthood. Our genes don't change, so those test results are good for their lifetime. So we're trying to say at day one, this is important for you, for your family, and for your physicians to try to impact and bring that pharmacogenomic testing literally in their first day of life.
There are some people who would say, I don't know how much I want to know, right off the bat. How do you answer those people who wonder about how much information you should have at the starting gate,
And the good news of what we're doing, it's really only how medicines affect people. It's not about disease risk or cancer risk. It's really just about medications. Not everyone agrees to this free service. There are some parents that would prefer not to. But again, we're really focused on how do medications affect patients and how that might be relevant for their childhood and their adulthood. And for many patients, most patients, they agree to wanting to have that for their children. And now they oftentimes want it for their other children who weren't born before we set up this test. So it's an exciting initiative that we're doing at our main hospital and expanding it across our health system this year, and literally a way of changing the culture of patient care for the patients, their families, and for the doctors, who oftentimes are the ones who are the bottleneck in revolutionizing this model of care.
I think in the medical field, everyone is always, looking ahead. Innovation is key to survival. Where is genomic testing going?
So I think the possibilities are endless right now. The main impediment was cost. So 10 years ago when the Human Genome Project was done, it cost $1 billion to genetically test one patient sample. This year it's about $1,000, and we expect over the next 5 years it to become $100. So when it's as cheap as getting a blood test or any other kind of medical test to do a whole genome sequencing, I think it's very probable, if not likely, that in the next 5 to 10 years, whole genomic sequencing will be part of healthcare for certainly patients that come from at-risk families, if not for children to prepare them for the rest of their lives. I think that's something we should all be ready for. The interesting challenge for that is actually the informatics, the technology, and the bioinformatics component of that. That's the technology to do the lab test has gotten simple and cheap. How to interpret it, how to incorporate it into medical records, how to do the bioinformatic analysis, that's where the challenge is. That's where the future is, I think, for this field.
John, thanks so much for spending some time with us here today. You're watching HIM17 TV.